For all patients undergoing total joint replacement, the number one rule is don't fall. All joint replacement patients should use cold therapy at a minimum of 3 to 4 times daily for at least 30 minutes. Please don't use heat on your new operative site. Cold therapy can be from gel packs, a cold therapy pump machine, or even frozen peas. Our number one post-op complaint is going to be constipation. Remember to stay hydrated, consume high fiber foods, ambulate, and use stool softeners or other medications such as Miralax, Benefiber, and the like, especially while you're taking narcotics. You should not go longer than 3 days without having a bowel movement. One of our nurse navigators will be following up with you for approximately 90 days after surgery. Please feel free to call one of them if you have questions or concerns. Additional information can be found online at www.erlanger.org/ortho, where we also have our total hip and knee replacement education manual in a digital copy. You should also have received a copy from your surgeon's office at the time your surgery was scheduled.